Thank you.
We're excited to have you here and hear about the latest in well with regard to material health and the intersection of all this data in the well standard.
More than happy. Do you see my screen? Am I confirming?
You got it. You're good to go.
And you hear me well?
Yes.
Excellent. Thank you. When they say I'm Rodolfo Perez from the International Wellbeing Institute. I would call myself an expert earthly, but to try as far as I can bring health and supply chain and highlight everybody's work towards a better built ecosystem currently in Argentina at the moment. So if my background is kind of it's because I'm in a back room and in a building here. All right, but let's talk about materials. And particularly what I want to talk today is about how materials in well have evolved and what we'll up to. This workshop is pretty much to know a little bit about what's up, what's next, and hopefully you'll get an idea of where our directions are and reflecting a little bit of the past to look at the future. If IWBI is basically the system that puts health first, people first into buildings, communities, and organizations. So we're trying to lead the movement when it comes to building health and provide a rating system that enshrines, as I said before, physical and mental well-being. In a few years in this quite fresh data, you'll see that we've grown to over 6 billion square feet in 130 plus countries, including Argentina, where I'm right now, and many others. It's interesting to be abroad and see actually the growth. Even here in Argentina, we have nothing certified yet last year, or some of them very iconic. And we'll hear more about it later, but I think the growth is really encouraging. Hopefully we'll continue that trend. You'll see it grow a lot in 2020. After the pandemic, health matters. We learned something the hard way, but hopefully we'll unlearn that lesson and actually expand it and make it even more attainable and approachable to us. So the question is, I want to reflect a little bit about this evolution. How did we get here? I mentioned pandemic. Definitely our focus on health has been our key. When we talk about health, social, mental, and physical, but we started maybe medical in a more, less flexible way to tenants, visitors, owners, and because of the need, because it's important. When we talk about health, definitely need to expand. How can we call a building healthy if it basically alters or damages health of someone else in the process? Health is not the same for everyone. So we have some target audiences that might need other interventions to more targeted interventions. People with classic examples, they are neurodivergent. On the other hand, as a world-based standard that we try to meet people where they are when it comes to health. So expanding a little bit the extent of health in terms of kind of breadth based on the building and deep in terms of what type of occupants and populations interact with the building has been one of the ways we're trying to expand our audience. Of course, never leave the basics, which is the one actually, the health safety, more operational, the one that actually gave us the ability to grow. We also expanded in terms of how to use well. I mentioned health is a subset of the well standard, subset of features, of strategies. We also have a performance rating, equity rating. So we went a little bit subsetting the set of well strategies and also expanding who can get access to it in a more streamlined way. In particular, our offering called Well Scale, we have entire portfolios. And I'm going to give an example that I expanded a lot footprint of well around the world. Instead of doing one building, you can do many buildings step by step in a more approachable basis. That's been key for the expansion of well. We can do well strategies without certification towards well certification. Reporting is a big thing for us. And I think from the industry, I ask many people, many architects, many designers, what are you doing? What are you seeking? Sometimes is to basically foster reporting. For example, here, these numbers come from the latest Uber report. You have the amount of impact that in their ESG reporting comes from whatever from well. SDGs, another example. Companies look for this to enable more and more. We have now with India some reporting strategies to do so. We can do well and what well means for health. So these three pillars are one of the basics. We have the case of Citibank. I think I presented this 2 years ago when I was here. And you can see how the city bank with like 2,500 plus locations around the world, how their expansion of the use of wealth started 8 years ago with 2 certifications in Hong Kong and India, health safety rating, pandemic, grow a lot of the location side, got into the scale offering to do more strategies in a stepwise basis, milestones at the world scale, getting involved with our work system, pursue the equity rating. More and to close the story about where I am right now, I visited today the first well-certified project in Argentina. By the way, that's a very interesting project because 2 floors, when they have one renovated area that is well platinum and one that's not renovated from 30 years ago. And unfortunately, I couldn't take photos, but the before and after is striking. This is how you can use in terms of expansion. We're here to talk materials, what they are, which is relevant and fundamental and evolving in well. You can see the evolution. Those of you who might have been aware of well V1, there were 7 concepts, which included material strategies, but they were spread around the standard. VOC reduction wasn't here, so was material safety, which was lead abatement and selection of product that avoid asbestos. Kind of the basic stuff, but it wasn't the best, very common place to put it, but we had to put it somewhere. Materials transparency, which is the disclosure under the organization of HPDC. Under V2, it became its own concept, something that is allow us to house strategies that on material selection in a more centralized way. All the chemical exposure we're trying to avoid, they're centralized now under the materials concept. So we already see the evolution, the relevance of materials. We see the relevance of material health as a fundamental part of our standard. What are we saying today about the standards? A little bit of where we are right now. For those who are familiar, you might see this before. We have a basic legacy materials avoid, in electronics or pipes, stuff like that. Now we go a little bit of the glass compound restrictions. Remove PFAS from architectural products, restrictions in LEED, including disclosure, for which HPs play a role, release avoidance products, inventory. And recently, the reason why I wanted to put this is in this 2024, we released our failure build products feature, which was a process that took us a couple of years to develop, but I'm very happy with what we came in and gives you ideas of what you can do to start, to bring health and supply chain, which is often neglected, the source of real health damage in materials fabrication. This is a problem. Like 28 million people are under modern labor conditions at this moment. It's something that we've worked with lean experts around the world. We got a lot of input from neurodiverse of 27 for Freedom, where we work together, trying to put something out that can drive the movement, drive recognition, and trying to find ways to get out of it. If a manufacturer pays fair wages, money talks. You pay fair wages, you're more likely to protect your workers. So it's not perfect, it's a good proxy. Similar, if you have certified raw materials, particularly those that are in conflict areas, you can do. We give you points. If you audit your supply chain, that's another alternative. If you're able to present audit reports of your manufacturers, supply chains that they state publicly what they're doing or what the problems, you get points. It's the first step of many. It provides a roadmap to start having the conversation and actual recognition of this problem. We also have, in the expansion of materials, works with well product certifications like licensing, matching what manufacturers have in their spec sheet, product transparency, the chemicals that are avoided, something you can create disclosures as an HPD. We license your ability to say where does it fit into the well standard, not only in the materials health, but also in performance. For example, a good panel might give you a good STC that might help achieve some well credits beyond the materials health. So an easy way to expand the system. When we talk about evolution, what am I trying to do here? First of all, we're going to double down alignment. I mean, if you heard me before, you might hear the word align many times, and I'm not going to stop repeating it. We need to align. Whenever we talk about materials, whenever we talk about health, we need a common language. We cannot go alone. Make sure that we can say the same thing at all places, at all times, should help. When we ask for information, that's what we're trying to do, and collaborate in those examples. Speaking of collaboration, we need to leverage other organizations to lead in the field. In the mindful materials concept, we work with HPD, we work with the USGBC and other rating system to empower each other to grow this movement. Otherwise, it's not going to grow. Clarity and flexibility are interesting. We're taking a look at the standard to make sure the language is clear. We're doing like large revisions to meet people where they are. And the flexibility side, we're trying to actually, again, meeting people where they are and trying to find out how they use the material strategies in a way that helps. Sometimes we might overwhelm people with our strategies. We're trying to avoid that, trying to meet them in terms of what their goals are and how can they use well to actually advance materials health. Advancing doesn't need to be full certification. We don't have a good way yet to put our material design selection practices into smaller steps, but we'll get there. And that's what we're trying to do, to take a hard look at the standard without changing the strategies much, but giving the flexibility and the clarity to get the content in to a wider audience, to expand who they are, to use more of what we have. We're working on it, which we've heard quite a bit today. The unified language, we can improve how to assess materials. We can quantify impact. We can do better benchmarking. We can tell a better story. Something that we do in design is try to tell a story, trying to have a conscious design that needs to be conveyed to owners and occupants. Health reporting is important. It's not who to tell directly, but how can we report a more strong framework? What do we want to do together? Not alone, I guess, increase audits to the entire movement. We're still a small version of the entire built environment. We need to see audits, and let's go big. We might not be perfect. Let's not be perfect to be enemy of the good. Let's go bigger and transform the market in a better way. I hope you got a little bit of what we're trying to do, and happy to take questions at the end. And thanks, Wendy, for this opportunity.